Yes, we can.
Very good.
Did you hear me?
No.
We will go on to the next speaker, please, and then maybe a little bit later before the lunchtime, if the audience has questions, we will come back to them. Thank you very much. Beautiful presentation. You've been almost perfectly in time.
Yeah. So
good.
Just let me know. Send a message to my phone because I will have to go offline now. Thank you very much for this. Bye-bye.
Okay. I honestly don't hear you, but we have to go on. Коллеги, следующий спикер у нас, значит, мы практически уложились, но поскольку у нас там нет задела на вопросы, пожалуйста, запишите их для себя. Меня слышно, да, сейчас, коллеги? Кто-нибудь реагирует?
Слышно, сам голос слышно.
Да, слышно.
Спасибо, спасибо. Значит, следующий спикер у нас, и потом все вопросы зададим, наверное, перед обедом. У нас очень плотный график сегодня. Это доктор Роберт Эванс, наш коллега из Соединенных Штатов. Спасибо ему огромное за то, что он отозвался на наше приглашение сегодня выступить. Это человек с огромным практическим опытом в области производства вакцин. Я высылал вам резюме его краткое. Вы успели, значит, ознакомиться с его карьерным профилем. Он занимался много лет и производством индейки непосредственно в компании Cargill в США. Он занимался производством вакцин в нескольких предприятиях. Вот, и имеет большой опыт работы именно с индейкой. Поэтому давайте послушаем презентацию и посмотрим, останется ли время. Если нет, тогда все перенесем на предобеденный небольшой такой вот тайм-аут нам. Хорошо? Dr. Bob, thank you very much for joining us today. You're welcome. The floor is yours. I'm switching off my demonstration and you can switch on yours. Hello, Dr. Evans. Dr. Bob. Так, микрофон выключен, но будет.
Now, can you hear me?
Hello?
Hello? Hello, can you hear me?
Dr. Evans, can you hear us?
Yes, I can hear you.
Hello. Извините, коллеги. Эти. Да,
Hello, can you hear me?
Screen, Dr. Bob?
Hello, can you hear me?
Мы слышим хорошо.
Hello?
Yes, now we can hear you.
Ah, very good. Very good. Now we can hear. Okay. I'm sorry for that.
Could you please share your screen with the presentation?
Okay, let me.
The Russian or the English one?
Yep.
The one you prefer.
There we go.
Oh, please.
Can you see my screen now? Can you see my screen? Hello? Hello?
Yes, we can hear you.
Okay,
we see the
okay,
screen.
I'm sorry.
Welcome.
Making sure we can see the screen and so, well, good morning. I'm pleased to be here this morning and visit with you just briefly about some bacteria that have been plaguing us for a number of years. In general, I would say that a single respiratory organism, such as Bordetella or ORT, seldom cause major disease when they're acting alone. However, when they're in combination with another virus or another bacteria, they can cause excessive mortality. Those others can be hemorrhagic enteritis. Newcastle is a classic one. Just saw that sometimes we see it silently. However, in conjunction with Bordetella, ORT, it can cause significant disease. Ventilation can be a major issue. If we have high levels of ammonia and poor air quality, we can see these organisms cause more damage, as well as just the stress of move and things like that. The best way that we can deal with those organisms is to have the best management practices and be prepared so that we know what sets that off, whether that's the move time or whether that's something that we're doing, another vaccination program, and provide the best optimal environmental conditions, both for ventilation and temperature. The food safety organisms that we talked about, Salmonella and Campylobacter, there's very few strains of Salmonella that actually affect turkeys directly and cause disease. However, they're of major concern for our food safety groups. And what I find is that the control of one works for the other just about as well. ORT, identified in the early 90s by actually a friend of mine, Paul Van Eppel, and he worked with the group in Boxmeer, the Netherlands, to characterize that. The pathogenicity of this depends on the strain that's isolated. There are various strains. Most of all of my background has been in the United States. We have relatively few strains in the United States, so we don't have quite the complexity that it has in the European countries. It affects older birds very severely. If you have breeders and they're naive and it's their first exposure, mortality can be excessive. What we see in smaller birds would be the coughing and the sneezing. And then in breeder birds, we'll see egg loss. There may be some production performance losses in weight in the meat birds, air saculitis, tracheitis, severe bronchopneumonia. Again, knowing that those can be exacerbated by other organisms that will pair up with it and cause much more severe disease. When we look at the diagnosis, when you culture this, it grows very slowly. Generally you want to culture it for about 48 hours to see some pinpoint colonies. You can do that on blood agar. Does not grow well in broth. It best if you have a reduced oxygen atmosphere, such as a candle jar or a CO2 incubator. There are a number of ELISA tests that have been developed. Some of those have been made commercially available. Some of those are diagnostic laboratory specific. And there are some PCRs that have been using different primer sets. I would caution that when we look at a PCR, it tells us that the organism is or has recently been present. Because it's looking at simply DNA, it does not necessarily say that you have an ongoing infection. It may say that you have just passed an infection, but there has to be some DNA presence, where the serology with ELISA would say somewhere in the past we had exposure to it. PCR is telling us more intimately what the disease state of those birds are. Early clinical presentation, in my experience, has been noted in the eye. If you'll notice on the left, the eye is a little bit rounded and then has a little bit of sagging under the lower lid, and that may progress to foaming, and that eye that lower lid will get almost a wrinkled or a gapping appearance. It hangs open. Whereas if I get a bird that has Bordetella, you will notice that the eye has a more almond shape with the point at the medial canthus. That bird, that eye will get even more of an almond shape. This would be very early onset, and it's very beneficial for the clinician to be able to look at these birds and say, I see something happening here, and knowing whether or not, based on the history of that farm and the conditions that are there, whether we should implement some type of treatment for that. The treatment options, there are various sensitivity patterns, so it's best to have some sort of antibiotic sensitivity testing to know which one to pick. But amoxicillin, tiamulin, interafloxacin, tetracycline, neomycin, tomicin all have the opportunity to help us with this disease. But again, there's varying antibiotic resistant profiles, and you need to know what that is, or your you're very frustrated with your treatment. That being said, when we see birds with the eyes that are beginning to change and we want to include a routine treatment, we bind them, add amoxicillin until we get antibiotic sensitivities back to see if we need to change, or chlorotetracycline or tolmicin. To prevent this disease, biosecurity is number one. However, we have some difficulties there because where this organism is in reservoir has been difficult to identify. It is pretty sensitive to good C&D. The products that we have for that generally kill it very nicely. There have been some attempts with inactivated products and breeders, and that does help. In fact, in the US, almost all breeder birds are vaccinated, generally with an autogenous, as there's not a commercial product, but with an autogenous ORT. And there have been some success with live controlled exposure in very young, less than 2 weeks of age, production birds. That has been an ongoing concern. The regulatory agencies in the United States don't have a process in place for controlling that across company or across state lines. So it is allowed by an individual company. They have to produce the product themselves, and that often leads to some additional problems because it takes a certain amount of expertise to work with ORT. Young birds from vaccinated breeders may actually delay the onset. This happened in my hands. We had vaccinated our breeder birds very well, and we thought we were out of the woods. Our young birds went through the brooder phase in good condition, and then were hit at a much older age, 8 to 10 weeks of age, with respiratory conditions. And we were not prepared for that to be ORT, and it got us pretty good. So we'll tell you that breeders with a good high titer can delay the onset in natural exposure if we're not able to deal with those poults, both through biosecurity and environmental controls to minimize what will happen with ORT. When I'm trying to understand what is going on with ORT, I will monitor birds on a biweekly basis with serology. You could use PCR. It just happens to be a little bit more expensive, which would be a more refined method of knowing exactly when ORT is being incurred by the meat birds. And as you do that, you can begin to see what a profile, generally, if I see them become serologically positive, somewhere 2 to 3 weeks previous was my exposure time. It takes about that long for a good immunity to develop. And so if I can look back 2 to 3 weeks, that would be the minimum. 4 weeks would be probably from a flock perspective. It takes about 4 weeks to be able to pick it up on serologic monitoring. It tells me when that's happening on that farm and helps me understand what steps I might take to try to remediate that. Basically, ORT is a very frustrating disease. We have not been able to develop dependable vaccination programs. We see that our antibiotic use, as it diminishes around the world, leads us with fewer tools to treat the disease once it happens. However, it is one that continually plagues us, and we need to be able to do what we can, leaving us with making sure that other organisms are out of our system, whether it's through vaccination that's available for them or better control, so that ORT will pass through the birds more silently than if it is in combination with those. Bordetella avium. It is a highly infectious disease. It can cause acute clinical signs. And we know that both Bordetella avium and Bordetella hensii have been implicated. Both of those love to live in the biofilm of water lines that are not properly cleaned. Because the two of these have been indicated, it we look for Bordetella, and if we see it in the water lines, basically we know that that particular operation has dropped their sanitation at some level and it needs to be corrected. It can cause very high morbidity of 80 to 100%, but usually the mortality is very, very low, at least in my experience. But when you add ORT or Newcastle, that can jump up to 40%. So again, it's one of those that when combined with another organism causes significant damage. Damages the tracheal cartilage. Just the toxin that it produces causes the cartilage bands to begin to collapse. And as it does, the birds simply lose the ability to breathe well. Generally thought to be resistant after 5 to 6 weeks of age. That's not always the case, as if you have significant ORT or Newcastle that hits the birds at a later date and you have Bordetella in your water lines, you certainly can see some response to that. Older birds become silent carriers. The culture of either Bordetella is fairly simple. We would always culture both birds, doing cloacal swabs or tracheal swabs, and we would look at water lines. Water lines were often the earlier indicator for us, as sometimes the tracheal cloacal swabs were not as quick to give us a response. There has been ELISAs developed for Bordetella, and they are routinely used in a monitoring program, which I'll talk about in just a minute. And with clinical signs, we see sinusitis, foamy, watery eyes, a snick or cough, open mouth breathing. Feathers of the head and neck become darkened where the bird is turning its head back and wiping it on its wings, and it's collecting dust from the mucus that's there. And so you'll see darkening on the shoulders or around the eyes. That's a good tip off that they are struggling with an upper respiratory disease. As said, the tracheal softens and eventually collapses, and eyes take on the almond shape in the medial canthus. So some of the treatments, again, we have antibiotics are generally considered ineffective. We just don't see good response to antibiotics. The best that we have been able to do is increase temperature in the house by 1 to 2 degrees and increase airflow. And that costs money. And so growers are reluctant to do that, but we have found that if you can reduce the ammonia that's in the house that's affecting that trachea, the cilia in the trachea, and now you have Bordetella affecting the cartilage rings, you can help those birds get through the infection, particularly when we're talking a single infection and don't have complicating cofactors in there. That will usually recover in about 1 to 2 weeks with subsequent lack of uniformity and performance losses. Prevention. This is one that is truly preventable through good water sanitation. And I can't emphasize that enough. Early on, I was with the Poultry Diagnostic Research Center in Georgia, which is our premier diagnostic program there, and one of the professor's sons raising birds would pop with Bordetella flock after flock. We went out and began swabbing and had cleaned the water lines, done a cleansing and a flush, and we used chlorine in that one to sanitize the water lines, and we would still pop with Bordetella. And we found out that 2 things: the diaphragm on the pressure regulator was old and had cracks in it. When we were cleaning that line, we were not getting into those cracks. And the threads where the regulator threaded onto the water line, when we went back and took the water line completely apart, we were going to replace the whole thing. We were able to swab Bordetella out of the threads of that water line. And once again, that biofilm built up on there. We could not cut through it with our cleaning procedures. And we replaced the entire water line from start to finish, and the problem went away from that farm. So my recommendation to my growers was, when we are cleaning the water lines, we are flushing between flocks at least once a year. take out the rubber diaphragm that is in the pressure regulator, throw it away and put a new one in. It's not that expensive. And to make sure that there is sanitation, whatever is preferred in those lines at all times. It takes very little time, and doing water medications, water probiotics, even vaccination, that short period of time can allow that biofilm to come back very quickly. And once it does, maintaining your sanitation levels in the water line becomes more difficult. We typically are in the United States using a chlorine dioxide with an activator, which helps us because it maintains a constant level of chlorine in those water lines. Other places can't use chlorine, and they're using other methods to try to do the same thing. Recommendation there is that between flocks, a peroxide cleaner, a vigorous, aggressive peroxide cleaner, be flushed into those lines, allowed to sit, and then the lines to be completely flushed out with sanitized water, and allow those lines to refill. In order to maintain that sanitation in the lines, when birds are placed in the brooder, those lines need to be flushed on a daily basis. The young poults, the water systems are designed for maximum capacity and density in that house right before they leave. And the young birds simply do not pass enough water through the line to keep adequate levels of sanitizer in the line. So by flushing that line, we refresh the sanitizer, and we're able to do a better job keeping the Bordetella at bay. Houses should always be disinfected between flocks. Beetle and rodent control is imperative. I had one grower who seemed to have recurring problems, and he had his mouse bait scattered around in some places. And I said, well, you need better rodent control. He says, well, I have all my bait down. And I reached over in the ante room and pulled the mouse off of the pipe that was running by. The mouse was running by on the pipe. And I said, well, it looks to me like your rodent control is not being effectively implemented. So we had to get better, and we were able to get the disease off of that farm as well. Vaccines, there have been both live and kill vaccines, and they have been disappointing. Some still use them, but at this time, I can't recommend any of them as being highly effective. Talking about monitoring the serology, this is one where, again, I will look at the flock at the end of their life. So when they're at the slaughterhouse, to look for past incursion of Bordetella in those birds, to monitor my farms to see how they're doing. And I can tell you that when I began this process on our farms, we probably had 10% of the farms that had a quality sanitation program. We were running about 75 to 80% seropositive at the slaughter plant. We implemented it across the board, chlorine dioxide with activator treatment and mixing for all of the houses. And within a single cycle, we dropped that to less than 30% of the houses that were positive for Bordetella, and the subsequent flocks that dropped down to about 5% and maintained at that level. So I believe it's something that we can address with good waterline sanitation. Talking briefly about Salmonella. Salmonella arizona, Florum, and Gallinurum has almost been eliminated in the U.S. Breeder flocks through simply a test and slaughter program. Those birds were removed and the houses were cleaned, and we rarely see any Salmonella that is pathogenic to our poults. There are some effective antibiotics if they're allowed. Generally, the mortality happens early. It may be intense for a short duration. And again, rodent control and biosecurity are imperative here. The single factor that will reduce Salmonella, whether in production birds or breeders, is rodent control. And I consider rodents anything from mice through skunks and larger animals as well. If they're not off the farm, if they get in the farm, you will have Salmonella on that farm. When we talk about food safety, we see in our experience that the whole carcasses have relatively low levels of Salmonella on them, but any of our ground products will see higher levels if it is endemic in the birds that you're bringing in. The control methods we use for food safety organisms are very effective for the ones that cause disease in poultry as well. Just one caveat, the comments are based on my personal experience. We had a significant salmonella outbreak in the company that I work for, with about 120 people infected with one mortality. That will certainly get your attention. And what I found is when it gets your attention in that way, you do everything that anybody ever thought of to try to control salmonella, and then you're stuck because you don't know which one of those things worked and which one didn't. You're in panic mode. So my recommendation is be prepared ahead of time. Don't ever get in that panic mode. It is not pleasant. So I'm going to say right now that to monitor, monitor, monitor. It's going to be expensive to get automated equipment, but I suggest it because the amount of monitoring you need to do is not easily done by trying to put it on a plate and culture for it. Get equipment. We had a piece of equipment that could run about 125 samples in a 3-hour period of time and give us some results back. We utilized that thing and ended up buying 2 more of them in order to operate effectively. The first priority for salmonella is you got to have clean poults. And I say that whether it's for meat birds or for breeder birds, they've got to come to you. They've got to come to that farm with no salmonella. The only way to do that is to make sure those breeder birds are not positive. So you can test and slaughter for disease strains. It's expensive but effective. But for food safety, we can't afford to when we get down to the multiplier fox or to the production birds, we can't afford to test and slaughter those, or we don't have any birds going into the plant. So there is a program that has been implemented. It's called Clean and Protect for breeders. And what it amounts to is the house is cleaned between flocks, and very good disinfection program, swab the nests, feed pans. These you test for to see that they're negative. If they're positive, you go back and do it again. What does that say? We can't push our breeder operations and say birds are going to go out and 3 weeks later the next set's going to come in. We've got to give them time to make sure that those operations are thoroughly cleaned. Once they are cleaned and they are prepared for the birds, if the next flock goes through and stays clean, it's much easier to keep that house clean. But I will tell you now that the rodent control is absolutely the #1 thing that must be done. In our hands, during clean out, we would bring in, it was a meal type bait. The mice and rodents, rats were attracted to it. It was required by law that it not be in place with personnel there except for a licensed applicator. So every day it had to be picked up by that licensed applicator, removed from the house while the workers were in the house, and then placed down the night before. In one house, the first night that we put that down, the next day we picked up 30 mice dead on the floor. That continued gradually dropping down for the next 3 days. And then we got down to where we had no mice left on the floors in the mornings. Felt like we had pretty good control. We then had an exterminator hired whose sole purpose was to make sure that those bait boxes were monitored, that the bait was changed out at appropriate times. And we were able then to hold some responsibility for them to keep our rodents out. We put electric fences about 6 inches, maybe a little lower to the ground around the outside of our breeder barns to keep skunks out. It was very effective. It also will trip you when you go to walk past it and when you mow, but it does keep the smaller rodents out. Beetle control, while very, very difficult because we just don't have agents that totally wipe out the beetles and they get into the insulation and into the floors and return, but they are certainly vectors that can carry the salmonella from flock to flock. Once the birds are in house, Test at least on a monthly basis via swabbing outlet fans. Be sure to turn the fan off. It can be very interesting when the worker sticks the swab on the fan blade and the fan kicks on. So be sure and turn those fans, unplug the fan, check the nest boxes, make sure that they are in, they remain negative for salmonella. So our Clean and Protect program, we vaccinate the breeder candidates, preferably with a live product at hatch, then 2 to 4 weeks of age. Repeat again at 7 to 9 weeks of age, and follow with an inactivated of the serotypes of interest. So if you've been swabbing those and you serotype those and you know that you have a HADAR there, you can build an autogenous for that HADAR to go along with what else you're using. Most of us are going to be using something that controls typhimurium and enteritidis, maybe Heidelberg, but you may want to add some that are plaguing you. And we have seen that be pretty effective, that if you can get a consistent program and you have HADAR or you have some of the others, you can push them out with that autogenous. One caveat, with over 2,700 strains of salmonella, when you push one out, another one is going to move in. We don't even believe that we can be at 0 salmonella unless we're raising birds in filtered cages and you know, impossible to do. So what we want to do is look at the ones that are of concern, highest concern for food safety, and keep those under control. If during testing, strains that are not the vaccine strain are detected, you treat with an effective antibiotic, suggest an antibiotic sensitivity test, but use something that is there. So again, this is in the Clean and Protect program. You revaccinate with the live program. Even if the birds are in production, it will have minimal impact on the birds. We have seen it, whether it was sprayed or drinking water, we really don't lose any egg production from those birds. And test. If the strains are detected that are not vaccine strain, you repeat that process. So treatment with an antibiotic and then revaccinate until those birds no longer show positive in the houses. That process has been effective. It's not cheap, but you can recover those breeders and have them produce offspring that are not positive for salmonella. If regulations do not allow you to process those treated birds, it's cheaper to send them to rendering or to landfill them than it is to have salmonella in your operation, particularly when you have a human outbreak. At the hatchery, extensive environmental sampling is required. We sampled drains, the plenums, the hatchers, the incubators, egg rooms, everywhere throughout that hatchery. We took swabs and really scrubbed to try to find where the salmonella was in the hatchery. We found it in some unusual places. It's very important. The hatch trays surprised us. We had a tunnel washer for our hatch trays. We had good temperature water. We had disinfectant going through there. We found out is that over time, small amounts of material stick to those hatch trays and it's not coming off. And that is the source for the salmonella to evade both the sanitizer and the hot water. That water needs to be at least 63 degrees Celsius. Those boxes need to get completely dry before we're going to put pulse in them or before we're going to actually swab and culture. What we would do is go look for any stains that were on those hatch trays that we could see, and we would scrub that. Even if we took a metal implement and had it clean and sterile, and then we would break away some of that and then swab that, and we would find salmonella in those places. So it's very important to get those hatch trays. That poult, when it comes out of the egg, is the most susceptible to colonization with salmonella at any time in its life. In the US, formalin use in hatcheries has been tried, and we saw 50% positive fluff samples drop to 2% after formalin. However, when we went to the farm and we looked at the birds at the farm, we were still having levels of salmonella that were unacceptable. We realized that what the formalin was doing was basically killing the salmonella that was on the fluff. We weren't so sure it was doing much for our poults. Poult trucks need to be sanitized between flocks, verified to be salmonella negative. And then we would spot check those on a weekly basis, which kept our crews honest in what they were doing. Hatch residue, those eggs that the poults that just don't make it are a great source to look for salmonella. Look at the eggshell, the poult itself, to see if we have salmonella in that residue. That would tell us a lot about what's going on with the flock. We also tried to do some cloacal swabs on the farm. That is not nearly as beneficial as taking some of the cull birds as they're on the farm and culturing the whole bird. The brooder, it must be clean prior to placement. And we would swab our brooders to make sure that we were clean for salmonella. We swab fan blades, feed pans underneath the feed pan, underneath water drinkers, the floors, the walls. We wanted to make sure that was clean. They need to have dedicated clothing and shoes for that house, not to walk outside the door, walk across to the next house. Those shoes need to stay inside the house. When the grower comes in, they need to put on clean or dedicated clothing for that house to minimize spread between houses. Once they walk outside, that is open territory for whatever's walked across that yard, whether it's a frog or a wild bird. There have been things moving across the gravel or the entryway outside. Always verify your C&D with swabbing. Water lines, similar to what we would do for Bordetellus, they need to be shocked and then cleaned with sanitizing agent and charged with sanitized water. We found that our litter could occasionally come in. Our litter sheds, when where they produce the litter and they make the shavings, are often open, and raccoons and other things can get on that litter. And if they defecate there, they can have a significant load of salmonella. Feed. Feed is a tricky subject, particularly if you're using contracted feed mills. If it's an integrator and has its own feed mill, it's not quite such a onerous saying. Feed mill managers don't like it when you tell them that they have salmonella in their feed. Boy, if that's a contract one, you got your hands full. The most frequent site that we found contaminated is the cooler, where those pellets are being cooled back down. And to monitor that, we drilled a very small 3 millimeter hole in the final drop leg and through the lid of a jar that was attached, and put a jar under there. And as the feed is running out over the day, small bits fall into that and allow you to test the feed that was made for salmonella. That was pretty effective for monitoring our feed mill to be sure that we were clean. My experience, that feed mill is a minor contributor, really not the major focus. Poults. If breeders, hatcher, brooder, and feed are clean, poults arrive very salmonella receptive. So it's a good time to introduce your competitive exclusion products that you might use, or live salmonella vaccines. Best management practices: get poults on feed and water immediately to help absorb the yolk antibodies from the hen, develop a good microflora, and reduce the chance for beetle consumption. No single additive is a silver bullet. Minimizing potential introduction is the best, and poults are most susceptible to salmonella colonization in the first 5 days. Those are important concepts to put in your mind and hold on to. In the grow out, rodent control, still your number one thing to maintain. Good intestinal integrity, good ventilation, keep those birds as healthy as possible. Acidification of the water for salmonella control in turkeys is not as successful as it is in chickens, as the crop is not the primary source of contamination in turkeys. It seems to be the neck and back skins that are the ones that are responsible for that. For the plant, clean and make sure the plant is properly cleaned. The grinders seem to be the most impactful area. What we found is if you're trying to hot grind, or you're not allowing the temperature to get cold enough on the birds that you're grinding, the temperature raises very quickly on those grinders and can get up to 70 degrees. 30 degrees very quickly. And at that rate, salmonella replicate. So you need to make sure that you can keep that grinder cool by having cold meat going into that. For us, that meant that after it came out of the chiller, it had to sit at least 24 hours in a cold room before it ever went to the grinder. If you're grinding necks and backs, you're going to see your salmonella numbers rise quickly. Make sure the rinse nozzles are adjusted. It's very easy for workers along the line to want to rinse off their hands or their gloves or their knife, and they reach over in front of that nozzle. They're supposed to have their own to do their hands. However, they'll reach across that nozzle a little bit closer and they bump it. And over time, they keep bumping it, and you find that it's no longer spraying where it's supposed to be on that bird. So make sure that those nozzles are adjusted and they are spraying where they're supposed to be spraying, so that any disinfectant that you may be using is applied in the proper place, or even just rinsed water is applied where it should be. If allowed in your chiller to use disinfectants, it should be a counterflow. The disinfectant should be added at the near the exit and at the midpoint. I'm sorry. So it should be applied near the midpoint and near the exit to make sure that the level is adequate there, as there is a buildup of organic material towards where the water is exiting. If using air chiller, the bird should not drip from any water that they have on others. When you're looking at salmonella product sampling, whole carcasses rinses for ready-to-eat product is the only thing we have. Part rinses are important. And then for grind, we would grab a large sample. We would combine it. If that sample came up positive, then we would look at the subsequent. So we would grab 2 samples from each bin, and we would take those 2 samples. We would put multiple bins together. If it showed positive for salmonella, we would go back and get the initial each grab sample and find out which one of the bins was positive. We utilized a threshold approach. So we had a level that we would allow because we realized we'd never get it all the way to 0 all the time. And if it was below that chosen level, you could proceed. If it was above that chosen level, it ended up in cooked product. We were able to get to a point where we did not have salmonella positives going out that were a detectable level. That level needs to be below the level indicated for infection in humans. Do I have enough time to talk about AI and HE?
We have 7 minutes.
7 minutes, okay. I kind of hurried through that I was thinking I didn't have quite as much time. So for AI in the US, high path AI caused by H5 or H7, they require government intervention, and basically they have their protocols in place. They're going to step in and they're going to take the farm away from you. They're going to own it until they're done with it. And the grower, the integrator, other than standing around wringing your hands and yelling back and forth at the government officials, really don't have anything we can do. My experience is the government does not react as quickly as I would like them to. They have extensive, often odd protocols, but my advice is don't make them mad. You make them mad and you'll pay for it. So just back off and let them tell you what they want done. Smile and say yes and get it done. Each area in our country, turkeys are concentrated in several areas of the country, and each area has its own low path AI plan. One caveat: in the United States, we are not allowed to vaccinate for avian influenza of any type. So the H5 and H7 cannot be vaccinated. You simply cannot do that. For H1N1, H3N2, the human and the swine isolates, breeders can be vaccinated with a killed product with approval from the state veterinarian. That's to protect against some production losses there. Other strains of influenza are not allowed to be vaccinated in the United States. So we don't have that option. We have watched that in the rest of the world, dealing with those, and have seen how the vaccine can be effective, but the option here is to try to eradicate rather than deal with it. What we've had is some states do a really good job of plans. So we have areas of the country, the Delmarva Peninsula, which is Maryland, Virginia, and Delaware on the East Coast, very high density of broilers. And they have a very extensive plan that deals with broilers. Was involved with the break there. What they didn't have was a good plan to involve backyard flocks, outside things, and that's where it originated and how we dealt with that. They developed their own, the integrated companies felt that it was important to be able to eradicate the disease. So they got together and implemented based on the pound of meat that they produced. They put money in the bank that was available to buy those farms or to depopulate those farms in a quick manner. Even before the government got involved, they could come in and get those farms taken care of and make sure that that grower would be responsive to them. Some states simply rely on the federal government direction and say, what are we going to do? Back to caveat number one, don't make them mad. My suggestion is a comprehensive plan with resources identified. When we had this and we had some 10 barns of 40-week-old toms, we realized that if you euthanize them in-house, we used foaming euthanasia. Couple of things. We found out that you have to have a very good water source. If there's any gravel in the water source, the foamer quits working. That's difficult when you're halfway through a house. You can tell I speak from experience on that. And then you decide that you're going to compost those birds. Well, you have to have carbon source to compost them. There's not enough litter in the houses. So you have to have that source available. You have to have people who know how to use equipment. Suddenly the grower with his skid steer, he can't handle 10 bards of dead birds, and he's going to have wheels on there, not tracks. And you find out that birds that have been foamed with firefighting foam are very soapy, they're very slick, and that tractor won't last in there. It'll get in there and simply get stuck. So you have to bring in skid steer with tracks, and you need somebody who's operated inside of a poultry barn, or you will not have a good poultry barn when you're done. They'll tear up equipment. We also found out that you have to be able to handle those birds while you're euthanizing them. Recently, we're looking at assisted ventilation shutdown, but at that time we were using foam. We realized that if you start at the back of the house and you're moving through with the foam, the birds begin moving, and we moved the end wall of the house about 6 inches off of the foundation from the birds pushing against it. Not a good scene. Make sure that you have competent operators and people at hand. The US does allow controlled marketing if it's approved in the local plan. And what happens there is the birds that are indicated by clinical signs that they have something is tested and they come positive for avian influenza or H5, H7, and it's low path. That farm is quarantined. A dedicated equipment is used on that farm. A feed truck only available to that farm that's disinfected on and off the farm. Those birds then are allowed to go through the cycle as with low path. We see it without having significant impact on the birds. Then they're tested, they're repeatedly tested on a weekly basis, and they must have 2 negative PCR tests prior to movement. Those tests need to be 3 to 5 days apart and less than 24 hours before the birds will move to the plant. So you're going to test and test and test. And once you get 2 negatives, you need to get them moved within 24 hours. So that takes some scheduling efforts. But we have found that we don't shed the virus when we're doing that. We have a mix of both serology and PCR used as testing. Serology tells me that the bird saw avian influenza sometime in the past. If it comes up positive, those birds will have to be PCR tested to show that they're negative going to the plant. In our area where I'm located, all birds are tested by PCR within 3 days of slaughter, 3 to 7 days of slaughter. All right. As we look at HE, we have some tissue culture vaccines in the United States, very low confidence in protection. Typically, we'll have to use 2 doses and it may or may not protect. I'm very interested in hearing about the killed product that was presented previously. We do not have access to a killed product in the United States. I certainly would like to know more about it. You see my email on there? Send me some information, please. Companies in endemic areas generally have a splenic preparation made. And again, that's going to be made by various individuals. Hopefully they have some skill in the art of doing that to produce that. And they'll take some of the tissue culture material and develop a splenic out of that and then give that back to the birds in a controlled exposure. What we see, if we see late respiratory in that 7 to 8 week of age realm, that strongly suggests to us that HE might be incursion. However, if we give too much of the splenic HE, you can also see the same immunosuppression and E. coli out there, generally not as bad. Splenic preps do cause immunosuppression at 7 to 10 days post-infection. And so it's best minimize stress at that period. Don't move poults 7 to 10 days after you vaccinated them for with a splenic prep or with HE. Give them time to get through that stress period. So adjust your movement so that you either move them before the 7 days or after the 10 days. Generally, our vaccination schedule is between 3 to 5 weeks of age. With the splenic, it will overcome the maternal antibody quite nicely and coordinate that with your move. Slight increasing temperature 1 to 2 degrees with increased ventilation for that 7 to 10 days post-infection seems to be pretty effective. Appreciate your time very much and would love to entertain any questions you might have.
Окей, коллеги, мы говорили, конечно, не о поросятах. Я прошу прощения за неточности в переводе презентации. Мы все ошибки исправим, просто было очень мало времени, очень много работы. Dr. Bob, thank you very much. It's a genuine pleasure to listen to a practical experience. People who work in the field, they have specific, very beautiful, practical, applicable presentations. So we appreciate it very much. We don't have much time left, but probably we'll have after the next speaker some time for questions.